The role of family in borderline personality disorder, BPD, treatment, how family members can support treatment and healing. Borderline personality disorder, BPD, is a complex mental health condition characterized by emotional instability, impulsivity, fear of abandonment, and difficulty in maintaining stable relationships. The impact of BPD on a person's life extends beyond the individual, affecting family members, friends, and other loved ones. Given that family dynamics are often intertwined with the symptoms of BPD, the role of family in treatment is critical to the healing process. In this episode of the Borderline Personality Disorder, BPD, podcast, we will explore the vital role of family members in supporting the treatment and healing of someone with BPD. By fostering understanding, communication, and healthy boundaries, family members can help create an environment that encourages emotional stability and growth. This episode will offer practical strategies for family members to support their loved one while also caring for their own well-being. 1. Understanding the role of family in BPD treatment. Family members often play a central role in the treatment of BPD, as they are typically the ones who witness the emotional turmoil, relationship struggles, and impulsive behaviors that are associated with the disorder. The emotional distress that a person with BPD experiences can significantly impact their relationships with family members, making it essential for the family to be involved in the treatment process. While therapy, especially dialectical behavior therapy, DBT, and other professional interventions are critical for treating BPD, family members can provide emotional support, help with behavioral changes, and create a stable environment that fosters healing and growth. 1.1 Why family support is crucial. Emotional stability. People with BPD often experience intense mood swings, fear of abandonment, and emotional instability. Family members who understand these emotions and provide a non-judgmental, validating environment can help their loved one feel understood and supported. Encouragement for treatment. Family members can encourage their loved one to engage in therapy and stick to treatment plans, which is particularly important because individuals with BPD may struggle with self-doubt and self-criticism. Key fact: family support is essential in improving the effectiveness of treatment for BPD. A compassionate and informed family can be a powerful source of strength for the individual in therapy and in everyday life. 2. Key strategies for family members to support BPD treatment. 2.1 Educating yourself about BPD. Understanding borderline personality disorder is the first step toward being able to help a loved one. Many family members feel confused or overwhelmed by their loved one's behavior, which may lead to frustration or anger. Educating oneself about BPD helps family members better understand the emotional distress and fear of abandonment that often drive seemingly irrational behaviors. Key fact: people with BPD are not intentionally manipulative or dramatic, they often act impulsively or emotionally as a way to cope with overwhelming feelings. Educating yourself about the symptoms and challenges of BPD can help reduce feelings of frustration and misunderstanding. Resources for family education. Many organizations, such as the National Education Alliance for Borderline Personality Disorder, NEBD, offer resources for family members. Books, support groups, and online communities can also provide insight and guidance. 2.2 Setting healthy boundaries. People with BPD often have difficulty respecting boundaries, and their behavior can lead to emotional chaos within relationships. Family members must learn how to set clear, healthy boundaries that support their loved one while also protecting their own well-being. Example of healthy boundaries: a family member might say, "I'm happy to talk when you are calm, but I cannot engage in the conversation when you are yelling." This type of boundary establishes a limit on behavior without rejecting the person. Consistency is key. It's important that boundaries are consistent and clear. Inconsistent boundaries can confuse a person with BPD and may lead to feelings of rejection or abandonment. Key fact: healthy boundaries provide structure and consistency, which can help individuals with BPD feel safe and understood. 2.3 Validating their emotions. People with BPD often feel misunderstood or dismissed by others, which can fuel feelings of shame, guilt, or anger. Validation is a key component of treating BPD, and family members can play an essential role in offering emotional validation. What is validation? Validation involves acknowledging and accepting another person's emotional experience, even if you don't necessarily agree with it. It's about recognizing that their feelings are real and important to them. Example, if a loved one with BPD is upset about something minor, a validating response might be, "I can see that you are really upset right now. Your feelings are important, and I want to understand what's going on." Key fact: emotional validation helps individuals with BPD feel heard and understood, which can help them manage their emotions more effectively. It reduces the likelihood of them acting out impulsively or feeling rejected. 2.4 Encouraging therapy and treatment. Family members can encourage their loved one to engage in therapy, follow treatment plans, and practice the skills they are learning in treatment. It is essential for family members to stay patient and consistent, as individuals with BPD may experience setbacks or periods of self-doubt. Key fact: people with BPD often feel overwhelmed or hopeless about therapy. Encouragement from family members can help motivate them to continue with treatment, even when they feel discouraged. Family involvement in therapy. Some treatment programs, such as DBT, involve family therapy as part of the process. Participating in therapy together can help families learn how to communicate more effectively and manage challenging behaviors in a supportive way. 2.5 Managing crisis situations. Individuals with BPD may experience emotional crises that can lead to self-destructive behavior, such as self-harm, suicidal ideation, or violent outbursts. Family members need to know how to handle these crises effectively. Crisis management tips. O. Remain calm and avoid escalating the situation. O. Listen without judgment, offering emotional support. O. Stay safe, if necessary, help them get the immediate support they need, for example, calling a therapist, crisis hotline, or emergency services. Key fact: during a crisis, the goal is to de-escalate the situation by providing a safe, supportive environment. Family members who remain calm and show empathy can help the individual regain emotional control. 3. Taking care of yourself as a family member. Supporting someone with BPD can be emotionally taxing, and family members often experience stress, burnout, or frustration. It is important for family members to also prioritize their own well-being and mental health. 3.1 Engaging in self-care. Family members should take time for self-care and engage in activities that help them relax, de-stress, and rejuvenate. Taking care of oneself is essential to maintaining the emotional resilience needed to support a loved one with BPD. 3.2 Seeking support for yourself. Family members may also benefit from joining support groups or seeking therapy themselves. Connecting with others who are in similar situations can provide emotional relief, practical advice, and the chance to share experiences. Key fact: support groups for family members of individuals with BPD, such as those offered by the National Education Alliance for Borderline Personality Disorder, NEBT, can be an invaluable resource. They offer a space to share challenges, find solidarity, and learn new coping strategies. 4. Conclusion. Family members play an essential role in the treatment and healing of individuals with borderline personality disorder, BPD. By educating themselves, setting healthy boundaries, validating emotions, and supporting therapy, family members can create a stable and nurturing environment that helps their loved one with BPD make progress in treatment. The support of loved ones is critical in managing emotional crises, building healthier relationships, and improving emotional regulation. While supporting someone with BPD can be challenging, it is important to remember that family members also need care and support. By taking care of their own emotional health and seeking help when needed, family members can help foster an environment of healing, growth, and compassion. In future episodes, we will continue to explore how families can support their loved ones with BPD, including additional resources and strategies for healing. Stay tuned for more insights into borderline personality disorder and how family can play a crucial role in the treatment process.